Hi everyone and welcome to our podcast. I'm Vitok.
I'm Enqi.
I'm Xingyu.
And today we're talking about Sustainable Development Goal SDG 3.
Which focus on good health and well-being.
So now, what do you think when you hear the word health?
I usually think about hospital and think I'm going to meet doctor.
However, SDG 3 is actually much broader than that. It's about creating a world where everyone has the opportunity to live a healthy life.
Yes, whether that means getting a medical proper care and receive a mental health support, or simply having access to clean water and essential medicine.
Now, before we go any further, I think it's worth asking, why does this goal even exist? I mean, health seems like such a personal thing, right?
Exactly. But the UN realized that if a country's population is unhealthy, the entire economy suffers. It's not just about individual well-being, it's also about national stability. According to this photo, 33% of men and 31% of women carry two health risk factors, with poor diet being the most common element across both genders, most frequently paired with obesity for women and alcohol consumption for men.
So when we talk about SDG 3, we're really talking about the foundation for everything else, like education, work, even safety.
What surprised me while researching this topic, health affects almost every part of our life.
Yeah, if someone is constantly ill or can't afford treatment, it becomes harder to study, and work, even take care of their family.
So, improving health not just only reducing disease, it also helps people to get a better chance to live and take care of their family. I think one area SDG 3 pays special attention to is mothers and young children.
Yeah, I agree. Even today, many women around the world die from complications during pregnancy, childbirth that could have been prevented with proper medical care.
At the same time, many children die from illness and they didn't survive it. The effect is treatable and avoidable through vaccination and early health care.
The goal is to reduce these preventable deaths and make quality healthcare available to everyone, regardless of where they live.
Another important part of SDG 3 is fighting infectious diseases, such as HIV, AIDS, tuberculosis, malaria, and hepatitis.
Yeah, in the past, people often focused only on physical illness, while mental health was overlooked or misunderstood.
But something that's getting much more attention now is mental health.
Today, researchers recognize that conditions like depression and anxiety can have a huge impact on a person's quality life, relationship, education, and the ability to work.
You know what really stuck with me while researching this? The fact that something as simple as trained midwife can make the difference between life and death.
It's wild, right? We take that for granted in countries where hospitals are everywhere, but in some places, women give birth without any medical supervision at all.
And that's exactly what SDG 3 is trying to fix, which is making sure no mother or child is left behind just because of where they were born.
Yeah, there's actually research to support this. Study published in International Journal of Mental Health System that mental health should be treated as an essential part of sustainable development, not as a separate issue.
It really shows that being healthy isn't only about your body, your emotional and physiology well-being matters too. While SDG 3 has made progress, there are still many challenges with standing in the way.
Yeah, for example, access to healthcare isn't equal around the world. Some people can visit hospital within minutes, while others have to travel long distance or simply can't afford the treatment. Researchers has also found that health insurance can make a significant difference. One study in sub-Saharan Africa showed that women with health insurance were more likely to receive paternal care and have trained professional assist during childbirth.
Yeah, that might sound like a simple improvement, but it can save lives.
Another growing concern is non-communicable diseases like heart disease, diabetes, and cancer.
Unlike infection disease, their conditions more often develop over many years.
But here's something interesting. When we think about diseases, we usually think of things like flu or malaria, physical stuff.
Yeah, but the goalpost has moved. More and more health organizations are realizing that mental health illness is just as disabling as physical illness.
Exactly, so while SDG 3 still targets infectious diseases, it now also includes mental health as a priority.
Yeah, they are influenced by diet, physical activity, lifestyle, and environmental factors.
Hospitals struggles with increased demand, routine treatment were delayed, and many people is experience stress, anxiety, and some isolation.
And then, of course, there was COVID-19. The pandemic reminded everyone how quickly healthcare system can be overwhelmed.
In many ways, it showed us that investing in healthcare before crisis is just as important as responding during one.
I think we all felt that personally. Suddenly, we were all hyper-aware of how fragile healthcare systems really are.
For sure. And the pandemic exposed something else too, which is health inequality. The people who got hit hardest were often the ones who already had the least access to care.
So, in a weird way, COVID-19 was a wake-up call. It forced governments to invest in healthcare infrastructure faster than they probably ever would have otherwise.
So, what can actually be done to move closer to achieving SDG 3?
Personally, one major solution is expanding universal health coverage so people can receive the care they need without worrying about overwhelming medical costs.
Yeah, I think government also can invest in hospital, healthcare workers, medical equipment, and public health service, so to make healthcare more accessible.
Prevention is equally important. Encouraging vaccinations, promoting healthier lifestyles, improving nutrition, and providing regular health screenings can reduce the risk of many serious illnesses before they become more difficult to treat.
Correct. At the same time, raising awareness to mental health can help reduce stigma and encourage more people to seek support that when they is needed.
So we've covered a lot: maternal health, infectious diseases, mental health, COVID, but I think there's one thread that ties all of this together.
What's that?
That health isn't a luxury, it's right. And achieving SDG 3 isn't just about saving lives, it's about giving people the chance to actually live those lives.
Couldn't have said it better myself.
When we step back and look at the bigger picture, SDG 3 isn't only about medicine, it's about giving people the opportunity to live healthier, longer, and more fulfilling lives.
And because health is connected to education, employment, and economic stability, improving healthcare creates positive effects that extend far beyond hospitals and clinics.
So to wrap things up, achieving SDG 3 will require cooperation between governments, healthcare professionals, communities, and individuals.
There is still many challenges to overcome, but continued investment, research, and public awareness can make a meaningful difference.
Thank you for listening.
We hope this conversation has given you a clearer understanding of why good health and well-being matter.
not just for individuals,
but for society as a whole.